70 years after its founding, the IWK Auxiliary is celebrating a platinum anniversary and focusing on its role as a catalyst for change. This is a fitting description, as platinum is an element that works as a catalyst, enabling other elements to work together while maintaining its own integrity.
Our mission is to support the mission of the IWK Health Centre, and we devote our time to helping women and children and the families located here in Nova Scotia and across the Atlantic provinces.
In 1946, a group of women formed an auxiliary for the Children's Hospital in Halifax. They wanted to help support pediatric health through volunteer efforts and fundraising.
The auxiliary was founded in 1946 by a group of 22 women who had been working diligently on the war effort, raising funds for Spitfires. They wanted to stay together as a group and continue to do charitable work, and they approached the then Children's Hospital Board to ask if they could form an auxiliary.
The first president of the IWK Auxiliary was Mrs. Kathleen Fraser. The original auxiliary consisted of 22 members. There are over 90 members in 2017. The total amount of money raised by the auxiliary since 1946 is over $8.4 million, and it was spent to support excellence in healthcare throughout its many iterations. For 70 years, the IWK Auxiliary has been an integral part of the hospital. This organization has been visionary, creative, and has often supported groundbreaking initiatives. Some of these initiatives have been firsts for Canada. In recognition of this milestone, the auxiliary committed $70,000 toward the new neonatal intensive care unit. The longest-standing project of the auxiliary is Kermesse. This has been a wonderful fundraiser and community event since 1946. It is a fair for the entire family and has raised over $3 million. Held on the grounds of the IWK, Kermesse creates a fun atmosphere for families to enjoy supporting the auxiliary.
A huge undertaking, massive amounts of volunteer efforts, and such a community builder. Brings people to the hospital during the fun fair, so they come to the hospital, and how great is it to have people come to the hospital for fun? Especially important for the children, I think, to be able to come to the hospital and have fun. And inpatients that are here when the fun fair is going on get to come down and partake in all the fun. So it's fantastic.
Another fundraiser for the IWK Auxiliary is Bigs and Littles, which opened in June 2005. It's a shop located in the Goldblum Pavilion of the Health Centre. It provides a wide array of goods and services to the whole IWK community. All proceeds benefit the auxiliary. Over $650,000 have been raised by the shop since it opened.
Very important for the patients and for the families that come in.
The auxiliary originally operated a shop called the Gift Horse between 1970 and 2005, which raised $1.5 million for the auxiliary during that time. A coffee shop was also operated by the auxiliary from 1970 to 1992. It was a haven for families, patients, and staff, and was beloved by everyone. One short-term and creative project of the auxiliary was the Game of Halifax, created in 1984 by the auxiliary, which raised almost $50,000 in less than a year. The auxiliary provides a family tea, which is held every week in the health center. The event was created for families over 30 years ago as a brief respite for family members.
I was volunteering here for working in the volunteer office, I should say, for 27 years. I decided that this would be the one that I would come back to do. And that's because of the people who do the tea. It's a fun time. And I like to interact with people that are here, and some of the patients, some of the return customers that we have.
It takes place every Tuesday from 2:30 to 3:30. The railway at the South Street entrance has been an attraction for young and old at the IWK since 2002 and was originally funded by the auxiliary.
The benefit of this program here in a public area is that A lot of the children coming in for clinics during the day know if they're coming to the railway hospital, as they sometimes refer to, they forget about the needle for the blood work that has to be done. And for most children coming here, it's something to really look forward to.
It's now self-sustaining and is run by a dedicated volunteer team of model train enthusiasts. The Auxiliary has long realized the importance of medical research in achieving excellence in healthcare and has given over $1.4 million since 1963. The Auxiliary gives $25,000 annually to IWK research.
Oftentimes what the Auxiliary has done is support the beginnings of research careers. And a small amount of money when you're desperate for starting off your career is so critical, and that's where they come in by giving that type of money that then gets multiplied again and again and again as people grow, as people expand their own careers. So it's really a win-win-win situation. It's a win for the children and women that we serve, it's a win for the researchers, and it's a win for the Auxiliary because they can see that their money does great good. The other thing that the Auxiliary does by supporting research is they send the message that research is critical to the care of patients. That message, we have to make sure that gets across all of the time, because that's as important in some ways as cash.
The Auxiliary made possible the creation of the Adaptive Equipment Loan Program, which helps children all over the province.
Recreation therapy was very fortunate in having been part of an IWK Auxiliary competition for funds as part of their celebration of 100 years. We were successful in receiving $50,000 in startup funds to create the province's first adapted equipment loan program for children, youth, and families. This particular program would support children and youth being able to freely choose what activities they'd like to participate in, because the equipment is specifically designed to support the needs they may have due to their physical disability.
The Family Resource Library is a special addition to the Health Centre. It was funded and built by the Auxiliary in 1992.
And I've been doing this for over a decade, and it's a very much appreciated service by the patients and families and staff as well. I very much enjoy it. I always feel like what I'm doing is very important to help patients and families feel comfortable and also be involved in their own health care, and give them a feeling of understanding what's going on health-wise with their family and their treatment here at the IWK Health Centre.
The IWK Auxiliary is also known for its contributions to child life in the hospital. It was funds from the Auxiliary that launched the Child Life Department by providing a salary for the first Child Life Director. Salary was provided for 3 years, and afterwards it became part of the IWK budget.
All different kinds of things that really make the IWK special for kids and families and teenagers. They also are a huge supporter of our activity area, our play program, our teen lounge, as well as our play program in the play garden in the summertime. And so without them, we wouldn't be able to do the things that we really value and benefit the patients and families that we work with.
Imagine as a child you have to be in the hospital for 2 or 3 months, and yet you can still go out to a play garden and go on a swing when the spring starts. That's really, really important, and that's going to get you better. Imagine a really, really sick baby who's here and you tell their mommy they don't have to go home anymore because there's a bedroom that's attached to their baby's room, and there's a bed there that the IWK Auxiliary has helped to fund. Those are the kind of immeasurable things that the IWK Auxiliary has done for us in the past, and I have absolutely no doubt that this group of volunteers will look at the next 5 years, 10 years, 20 years, 70 years, and think of that thing that we scientists haven't yet thought of that's important to children, to their families, to their parents, and make it happen. I just want to say a great big thanks to our IWK Auxiliary for everything they've done for the last 70 years and for the next 70 years and beyond, because I think this working relationship is one that is very special and one that sets us apart from other organizations who don't have that same kind of volunteer experience that we have. So thanks.
70 years, what can you say about that? What can you say about $8.4 million of funding that the auxiliary has been able to provide the IWK Health Centre in support of various programs? It's absolutely outstanding. You don't see philanthropy like that every day. The auxiliary is woven into the fabric of this organization and has been a huge supporter of the IWK and its programs over the years.
The IWK Auxiliary is a tremendous success story and so important to the health center. It has and continues to have a great impact on our patients and families and communities that we serve here at the IWK. On behalf of the health center and the board of directors here at the IWK, I want to congratulate the auxiliary on such a remarkable milestone. 70 years, wow, that's tremendous. They have much to be proud of, and thank you so much for everything you do.
The amazing things that the auxiliary provides to make those stays in hospital just so much better, to make the children more comfortable, or as comfortable as possible as you can be in a hospital when you're 5 years old and you're in a bed. So those are the things that I'm so proud of being part of as the auxiliary.
At 70 years, the IWK Auxiliary is celebrating its cutting-edge tradition of being visionary and innovative in its approach to supporting healthcare for children, women, and families. Members of the IWK Auxiliary have been catalysts enabling change by supporting new and unique projects, by supporting existing programs, and by helping to fulfill the creative dreams of staff as they adapt to the changes and challenges of providing excellent healthcare at the IWK.